One stretch that has been popularized in the sciatica pain world is the Mackenzie back bend. If this term doesn't sound familiar, then something like a backwards bend or a cobra press up from the floor might actually ring a bell. And this was actually generated and coined by Robin Mackenzie, a physiotherapist from Australia, who accidentally had one of his patients lie face down on a table that was actually inclined up. The patient stood up and said that their pain went away entirely, and this resulted in the investigation of this mysterious movement and why it was so helpful. But if you Google the cobra press up or the back extension exercise for sciatica pain, you're actually going to find an equal amount of articles saying how this stretch can actually make sciatica pain worse, while also other articles saying that this stretch can be very helpful. This is utterly confusing and frustrating, and it really just brings up a lot of questions. So what gives? Will this stretch actually help me out with my sciatica pain? And the truth is that it depends on a couple conditions that are going to be described in today's video. Number one, a posteriorly herniated disc that is truly the cause of pain, also known as a bulging disc. This can be confirmed via an MRI. If the herniation is towards the side of symptoms and presents itself along the correct level of the nerve root, then back extensions might actually be helpful. It's theorized that the backward bend may actually push the contents back into the disc base itself, resulting in pain relief. If the pain is reduced as a result of the backwards bend, then there may not even be any sort of MRI evidence of a disc bulge, but the body and nervous system simply just prefers extension or this motion. The only way to find out to see if this stretch helps is to actually try it out and see if it has any sort of effect. A back bend, aka a back extension, might actually not help if the symptoms include there's no herniation confirmed via MRI, and if there is too much arthritis going on in the spine, and this can usually occur around the intervertebral foramen, aka the openings near the nerves, and if there isn't enough room for the nerves to pass through this area, then backward bending might actually cause this space to close down and pinch on the nerve, resulting in pain such as sciatica. Another sign to tell you that this stretch is not helping is that the pain increases or spreads out as a result of the backwards bend. Again, this is the body actually telling you that it does not prefer to do a backwards bend, and you should be avoiding it for now. Remember, you are the true test if something works or not. So if it hurts more, avoid doing it, do less of it, and if it feels better, then this stretch could be helpful for you.